Okay, once again, good afternoon. Thanks everybody for taking the time out of your day. We're going to be talking today about varicose veins and specifically what causes them. Okay, so let's get started here. I'm Dr. Jacob White at USA Vein Clinics, and I've been practicing vascular medicine for about 10 years, previously at some other institutions that you can see here. Now I've been at USA Vein Clinics for about 3 years, and I'm really excited to talk to you about varicose veins and specifically what causes them. So we'll be giving an overview of vein disease, kind of define what makes a varicose vein, talk about some of the risk factors, common symptoms, and then at the end, what we can do about it in terms of treatment, surgical, procedural versus non-surgical, and what we can do here at USA Vein Clinics from the comfort of your own home via telemedicine. And then at the end, we'll reserve some time to answer any questions that you can type into the chat box, or if you have a microphone, you can shout them out at the end. I'll be happy to stay on and answer all of them. So when we're talking about vein disease and varicose veins, it's really, really common. I'm sure you, someone you know, or some of your patients have them. According to the American Society for Vascular Surgery, at least 20 to 25 million Americans. So really we're talking about 1 in 10, 1 in 15 people around have varicose veins. So when we're talking about varicose veins, typically we're talking about the legs, although not exclusively. And yes, it's very common. And the medical term is venous insufficiency. Veins, they have a job. Their job is to move the blood back up towards the heart. And when they can't do that, we call that insufficient. So the other term for varicose veins is venous insufficiency. And this occurs when the valves or the walls of the veins start to malfunction and they can't move the blood very well. The vessels become weakened and they physically cannot pump the blood. So gravity pulls all the blood down towards the you or the patient's ankles, and that causes this elevated pressure in the veins, and it causes the varicose veins and some of the other symptoms and complications. Here's a little graphic. I hope you can see it. On the left, this is a normal healthy vein, and these red circles are the red blood cells. They should be flowing from bottom to top through this little valve. Inside our veins, we have these valves to prevent backwards flowing blood. If we didn't have these valves, all the blood will be pooled in our feet and ankles, and it would not come back up towards our heart to circulate to all our organs. Over time, these valves inside the veins can become weakened, and there are lots of different reasons why that can happen. But when they do, all the blood goes backwards through this valve back down towards your ankles, and that causes these veins to be diseased and to become varicose and to get larger and larger over time. I hope you can see this graphic of, on the left, the healthy vein, all the blood is moving back up towards the heart. On the right, we have this diseased vein where the blood is able to flow through this valve back down towards the feet. So when we define varicose veins, it's a valve that's not working, and this backwards flowing blood causes it to pool inside the vein, and the veins become very large and very tortuous, and they start twisting around, and that's what we call a varicose vein. Where do varicose veins come from? Well, they can be anywhere in the body, but specifically, they're most commonly in the legs. The reason being that gravity pulls all the blood down, and so the legs have the hardest time of bringing the blood back up towards the heart. Our arms were moving around, our body were moving around, but the legs have to fight gravity the most. And so varicose veins we typically talk about in the legs. There are a couple larger veins, and they're connected to smaller veins that we call superficial veins. The superficial veins are the ones that become varicose, and those are the ones that are the weakest. They have the weakest valves, and those are the ones that tend to bulge out and become these varicose veins as the blood collects in these superficial veins. So we already introduced the term venous insufficiency before. Now, when we talk about varicose veins, we'll talk about superficial venous insufficiency. The deeper veins are bigger, they're stronger, they generally don't become varicose or insufficient. It's these superficial veins just underneath the skin. That's what these varicose veins are. Over time, they tend to get worse and worse because we walk around and gravity keeps pulling the blood down keeps putting pressure on these diseased valves and these diseased veins. And there's a grading system. It's called the SEEP classification, and it's graded 1 through 6. We have some representative pictures here. C1 we reserve for small little veins. Generally they're called spider veins, and they don't cause too many symptoms. C2 is true varicose veins, these bulging, twisting veins just underneath the skin, and that's when we start to have a lot of symptoms. The symptoms of varicose veins tend to be pain, cramping, burning, itching, heaviness, swelling, a lot of those types of symptoms. When we get into C3, the blood has now left the vein and it's affecting the surrounding tissues, and that causes edema or swelling. C4 are skin changes. The skin can be red or dark. And then C5 and 6 is the worst, most feared complication of superficial venous insufficiency, and that is when the skin breaks down. That's called an ulcer, and that leads to infections. And due to the superficial venous insufficiency, it's very difficult to heal these ulcers without medical treatment. And then the worst complication of an ulcer is either a really bad infection or even an amputation. So left alone, these veins can get very, very bad, and they can cause a lot of very serious problems. They're generally referred to as kind of like a bag of ropes or something like that, as these veins get bigger and bigger and they're twisting around. That's kind of what we see when these veins get really, really bad. And we do see a lot of them. So I mentioned this before, but a lot of people have questions about spider veins, so we like to differentiate between the two. If we go back to our grading system, spider veins we call C1 disease, where it's very mild. It's just some small veins that are popping out. Those are called these spider veins that you can see on the right here. They generally don't cause a lot of symptoms, although sometimes they can be kind of itchy, and cosmetically, a lot of patients don't like them, so it's not unreasonable to treat them. Varicose veins are when those veins start to get really, really big. They're bulging out, they're swollen, they look like a knotted rope, and they can be seen through the skin, and they cause a lot of symptoms: pain, cramping, burning, itching. All of those symptoms are associated with varicose veins. So what causes varicose veins? So we already said varicose veins are weak or damaged veins that can't pump the blood properly. Gravity pulls all the blood down, and that causes the legs to become swollen, discolored, painful, etc. So there are a few risk factors that we talk about. One of them is inactivity. The reason being, these veins are very weak, and these valves are weak, and they require the muscles around the veins to help pump the blood. And that happens when you walk around. So anybody who sits or stands for long periods of time, that puts pressure on the veins. The blood is allowed to pool in the ankles. So we always tell patients, make sure you're walking around. It's also why we see a lot of the same jobs of our patients that come in, a lot of people who are on their feet the whole day, teachers, hairdressers, etc. If you can't walk around, that puts you at risk for these varicose veins. Number two, if you have a family history, it definitely has a genetic component. Varicose veins tend to run in families. Overweight or obesity, that also puts pressure on the veins. It's harder for the veins to pump the blood through legs that are overweight. And as we get older, that also is a risk factor for varicose veins. Another risk factor that we talk about is something called compression syndromes. You can imagine the veins in your legs. It's like a tree. There are all these small branches. You can think of the veins down by your feet as the smaller branches, and they join together and get bigger and bigger as they go up the leg. This is a small picture, a small graphic of the blood vessels inside the pelvis. As you can see, there's a lot going on. The blood vessels in red are called the arteries. Blood vessels in blue are called the veins. And these are bigger veins. They're not in the legs anymore, but they can become compressed. Okay. One of the most common compression syndromes is called May-Thurner syndrome. This is when the left iliac vein up in the belly is compressed by an adjacent artery. And you can imagine if that one vein is compressed, all of the upstream arteries, all those veins all the way down the leg will have increased pressure. So this is not so uncommon to have this type of scenario. There's something going wrong in the belly that can affect all the veins all the way down the leg. So it's important when we take pictures, we do ultrasounds of the legs or CAT scans or that sort of thing. We're not just looking at the veins in the legs. We have to look higher up as well to see any compression that's affecting all those other veins. A couple other risk factors. We already mentioned long periods of sitting. So if you do have to sit a lot, try to elevate your feet. That relieves some of the pressure from gravity, or if you can get up and walk around, that sort of thing. Pregnancy very commonly leads to varicose veins. Just like in those compression syndromes, pregnancy puts a lot of pressure on those veins in the belly, and that puts a lot of pressure on the veins on the legs to bring the blood back up. It's simply just not enough room to move the blood through there, and that causes worsening of varicose veins. Some of these symptoms we already talked about. Heaviness is the #1 symptom. Blood is heading down, but the veins cannot bring the blood back up. So that creates extra weight in the legs. Heaviness is the #1 symptom we see from varicose veins. Also itching and burning. As the blood just sits in the veins, it tends to cause those symptoms: itching, burning, crawling sensation. Swelling is very common. Remember, that's C3, that's the next stage after the veins fail. That starts to cause the swelling. And then pain when the legs are elevated or when you walk around, because that allows the blood to be pumped up through the legs back to the heart. A lot of patients say they have to sleep in a recliner, or they sleep with pillows under their feet, that sort of thing. Whatever we can do to fight gravity and bring the blood back up. So it's elevation, it's walking around, it's compression socks. Those are very important. They're tight socks that are tighter down by the ankle, a little looser up top to help bring the blood back up. These are all things to help overcome some of the pressure inside these varicose veins. Effects of varicose veins on the skin. Well, #1, the veins themselves, they become swollen, twisted, they start to bulge out. Dry skin is very common. A lot of patients are putting on a lot of moisturizer. They think it's a skin problem. In reality, it's a vascular problem, and you have to fix the vein, not just treat the skin. Skin discoloration is very common. It can be red and inflamed. Alternatively, it can also turn dark, especially down by the ankles. It's a special kind of vein disease called lipodermatosclerosis. The vein becomes very thin and shiny and dark. That's a very severe form of vein disease, but unfortunately not uncommon. And then the worst type of vein disease are the wounds. If the veins are failing and they can't move the blood, the skin can break down. It's very hard to heal these wounds. A small wound can become a big wound, and it can take months and months and a lot of treatment to heal these wounds. Complications of varicose veins. They come in a few different flavors. Usually varicose veins are not life-threatening, but some very serious complications can occur. #1, ulcers. We already spoke about that. Once the skin starts breaking down, that's a very severe form of varicose vein disease, or superficial venous insufficiency. And without prompt treatment, those ulcers can get bigger and bigger and lead to an infection risk and an amputation risk. Blood clots. Blood will clot if it's not flowing. So you can imagine these veins that are not moving the blood is just sitting there, and over time it can form clots. That's when the blood clots up and the vein becomes very hard, very painful. And if the clot extends into those deeper veins, that can be a very serious situation as well. Bleeding isn't super common with varicose veins, but every once in a while it happens. These veins are very close to the skin, they're bulging out of the skin, and there can be a cut, or you can bang your leg against something and that can open up those veins, and there's a lot of blood sitting in those veins that can cause a lot of bleeding. So what kind of treatments can we do for vein disease? Well, I spoke about some easy things that you can already start at home. Elevating your legs, walking around, avoiding sitting and standing. Those are all things that can help out the veins in your legs, pump the blood. The next thing that we do is we recommend tight compression socks. Like I said before, they're tight socks that are tight enough to help move the blood, and they're called graduated. So they're tighter down by the ankle and looser up by the knee or the thigh to help bring the blood back up. As you can imagine, we're trying to fight gravity here, so the socks have to be worn during the day when you're sitting and standing. At night, when you lie down, it's not nearly as important to wear the socks, but it's not harmful. Once we've gotten past those lifestyle factors, the conservative therapy like the compression socks, we move to procedures. Once these valves break, they never get better. It's impossible to heal a valve, and over time, the veins get worse and worse. So we have lots of different procedures to treat these veins. I've highlighted 4 of them here, which I'll just briefly talk about. Number one is the laser, EVLT or endovenous laser therapy. This is the best, safest, most well-studied way to close down a vein. A laser is a laser on a string. It's a fiber that's inserted through a needle hole inside the vein. And after some local anesthesia is given, the laser closes the vein through heat. It literally burns the vein closed. These are veins that aren't working. They're never going to get better. And if we close them down, it prevents pooling of blood. So all these treatments, these procedural treatments are closing down veins. So number one is the laser. That takes about 5 or 10 minutes, and that's reserved for long, straight veins. When we showed pictures before of those very tortuous veins, the laser is too stiff. It can't pass through those veins. So while we prefer to do the laser, it's reserved for those straight veins. Clarivein is a newer modality to USA vein clinics. That's also for more straighter veins. And that doesn't involve as much local anesthesia, so it's a little more comfortable for the patient. It's a device that has a rotating fiber or wire that kind of roughs up the inside of the vein to scar it down so that it heals closed. In addition, it also delivers a medical solution, a sclerosant, to also help close down the vein. Clarivein also takes only 5 or 10 minutes. There's no local anesthesia needed, and it's pretty quick, but again, only for those straight veins. Those bigger bulging veins can't take any device. They just can't physically go through these tortuous veins. So we have liquid sclerosants that can pass through these veins. The first one is called Varicose. It's a microfoam, a very thick foam, kind of like shaving cream, and it's injected into the veins through a needle, and it's liquid enough that it can travel through these tortuous veins. And then it's kind of sticky, so we wrap up the legs and we compress those veins, and the veins stick together and heal closed. The last modality here, ultrasound-guided sclerotherapy, is similar to Varicose. It's one needle hole into the vein, and then we inject a medicine called a sclerosant, which again is a sticky solution to help close down the vein. All of these treatments are procedural, they're non-surgical, they're done in the office, and they only take a few minutes. There's no downtime at all. The patient hops right off the table and walks right away. You can go to work right away, walk around. There are a couple of restrictions in terms of needing a compression sock and not doing any heavy exercise, but in general, there's really no down effect on your life. There's no downtime. You're walking around, you're going to work, you're doing everything you were doing before almost. Here's a representative image of the endovenous laser. Previously, 15 or 20 years ago, we used to remove these veins. Now we have these treatments like the laser that close down the vein. It's much safer, it's much quicker, and there are fewer complications. That's why we always like to do the laser or the injections rather than removing veins. Removing veins is also called phlebectomy or microphlebectomy. That's something we try to avoid. It's less comfortable and it has more complications. So the laser, if you look at these images here, there's a varicose vein. We put a needle into the vein, and the laser fiber is on a string that goes on the inside of the vein. We do give some local anesthesia so you won't feel the heat. Then the laser fiber is slowly removed and it burns the vein closed. And the vein is closed right away after treatment. We wrap up the leg and the patient just hops off the table, uses some compression for a few days, but the vein is essentially closed right away. So those are some of the things we can do for your veins. We have some different procedures. They're all done in the office. They're very quick, 5 or 10 minutes, couple needle pinches, no cutting, no scars, no downtime, nothing like that. Before we get to any procedures, we do have to have a clinical visit. We can do telemedicine here at USA Vein Clinics. We can do it over the phone or a video chat. We have a lot of doctors all across the country. We're in 12 or 14 states. We have almost 100 offices all across the country. Personally, I'm here in the New York City area, and we're happy to talk to you over the phone and talk to you about your vein disease. Then we'll bring you into our office at the appropriate time after the coronavirus has resolved a little bit, and we'll do an ultrasound and map out all the veins in your legs. It's a very comprehensive ultrasound. We do it lying down, sitting up, standing up, to really take a look at all the veins. We make sure there are no blood clots, and we see if there are any broken valves, any superficial venous insufficiency. Then we see if that correlates with any of your symptoms, and at that point we can offer you some of these procedures to help close down these veins and get you feeling better. At this point, I'd like to open the floor up to any questions. We'll unmute your microphones. So you can talk into your microphone, you can type any questions in the chat box here, and I will stick around and answer any questions that you have. Thank you all so much for joining us, and I hope this was some useful information for you. We hope to see you at some of our offices. You can also go to our website here, www.usaveinclinics.com, and you can also schedule a telemedicine appointment on the website as well. So thanks again for joining us, and any questions, I am ready for you.